kind of anesthesia should I have for facial surgery?
It varies somewhat. There are some procedures that we can do with no anesthesia other than numbing the patient's skin with an IV, a needle, I should say, with lidocaine. That's rare, but there are smaller things we can do like scar revisions, removing moles, upper lid blepharoplasty. They really don't need any anesthetic if they are so inclined. A lot of patients, however, have somewhat of a white coat fear, and even though we can technically do their surgery without any sedation, they prefer something, so we give them a conglomerate of pills that makes them sleepy. We don't necessarily start an IV. Most of the time we don't have to. But we give them some pills that make them sleepy, and then we can do things like an upper lid bleph, etc. That even expands it a little bit to other procedures such as a medial platysmoplasty, where we work on the neck in younger patients down here. Sometimes a signature lift, which we do on younger women. I don't think that's a good procedure for men, which we can do under local without an IV. When we get to the procedures that are more advanced, if you will, or more involved, typically for older patients, those patients are not candidates for that approach. They need to be under anesthesia that's more complete. And in that case, whenever I'm putting somebody to sleep, to the point where they're sleeping, I want to have control of the airway. So I use an endotracheal tube and give them some oxygen and keep them under anesthesia with a microdrip of Diprivan and remifentanil. I find if you don't control the airway, I think you're not doing the procedure as safely as possible. I find that much safer for patients to have that airway under control. So the anesthesia varies anywhere from local to general, and we're set up to handle whatever anesthesia that patient would benefit from the most, and to do it safely.